Good afternoon, everyone. Thank you so much for joining us. I'm Darria Long Gillespie, and looking forward very much to our panel today. So again, I'm an ER physician, and I'm ShareCare's SVP of Clinical Strategy. ShareCare is a digital and population health engagement company founded by a former founder of WebMD, Jeff Arnold, where we pull together a broad suite of tools to truly create all of your health in one place. In addition to my role as SVP of Clinical Strategy at ShareCare, I'm also a practicing ER physician. And just to address the elephant in the room, I'm not as pregnant as I look. So, and I'm an ER doctor, so you're all in good hands, so we're fine. And so my role at ShareCare, in addition to a couple other roles in the media that I do there, is to, in some ways, be the clinical police, overseeing our team of about 35 physicians and affiliated health professionals, to oversee our 200,000 plus clinical health assets that we have. But then most interesting for today, and my 2 degrees pulled together, is my role now overseeing our population health programs and their development. We recently acquired a company called Healthways, a very long-standing population health company. I'm sure many of you are probably familiar with it. And our challenge now is, how do we take what we know is some of the best clinical information, but how do you wrap that in behavior science and hyper-personalization, and then use the very best cutting-edge frictionless technology to really get that holy grail of engagement, outcomes, and ROI. So that's what we're going to be talking about today. And why digital health? So, I know from other things digital outside of health, all of you, if anybody wants to order dog food, I can order dog food, it'll be at my house on Amazon Prime now before I'm even home. If anybody gets bored in this panel, you can get an Uber in 4 minutes. And if you really like the panel, you can wire any of them money on your smartphone in about 3 minutes. But it doesn't happen in healthcare. And it's not for lack of trying, it's not for lack of smart people. It's because in healthcare, the stark reality is that inspiration is different from aspiration, which is different from reality. And that's due to a lot of hurdles that exist: liability, security, privacy, interoperability, reimbursement for the different providers and payers and different players in the space. Also, how do you deliver information that's very dry, that often people don't want to hear about, in the right time at the decision point? So the hurdles are high, but obviously we think that the rewards are higher. We also know that people want to use these. Employers are spending more and more money on health and getting lower and lower engagement rates with their employees, with their health risk assessments and a variety of other tools. Physicians want to use it. A recent study by the American Medical Association showed that over half of physicians were strongly enthusiastic about digital health tools, but only 10 to 20% are actually using them. We also know that consumers want to be using them, but again, it's not yet reality. So that's what we're going to talk about today. What are the obstacles? What's the business case? And then how do we unlock that value? How do you get consumers to use it? How do you get providers to use it? So we have a great panel today. I'd like to introduce them really quickly. We have Nirav Desai sitting right here closest. Nirav has spent the last 25 years in healthcare and related technologies, including executive roles in strategy, marketing, and operations. Currently, he's a principal healthcare strategist at Mobiquity, a professional services firm focused on humanizing the digital experience. In his role, Nirav develops digital health strategies for Fortune 500 organizations across the healthcare ecosystem, helping them to improve patient care, reduce cost, enhance care experiences, and create sustainable competitive advantages. Next to him is Sugiyama, who is director of Vodafone Americas Foundation. It's part of a network of 27 Vodafone foundations worldwide. June has been in corporate philanthropy for 18 years, and she says in telecoms for longer, but she didn't specify. And they developed technology-focused strategy to align foundation programs with company expertise, and operates a signature program called the Wireless Innovation Project, a competition to seek the best wireless solutions for social impact. Last but not least, we have Theo Harvey. Theo is CEO of SynsorMed, which is an mHealth software platform that eases the lives of patients suffering from chronic conditions by delivering actionable data to healthcare systems. He also serves as an adjunct professor for healthcare informatics at Georgia State University, and has held business development roles at Cisco Systems, and received his MBA from Emory and Masters of Electrical Engineering from Georgia Tech. So I'd like to welcome all of our panel, and let's get started. switch positions really quickly. So I would like to ask each of you to really quickly address some of the biggest obstacles. I alluded to them in the beginning, but just quickly, what are one or two of the biggest obstacles that you see to digital health having widespread engagement and use?
Yeah, so I think two things that really hold it back are, one, sustaining the outcomes that people are interested in, and two, making sure that all the different types of stakeholders are getting something out of it. Because if you don't get everybody involved, then you don't really get the adoption.
Well, I think I'm the oddball in the crowd here. I come from the nonprofit side, so my perspective comes from healthcare in the low-resourced area. But some of those things translate over to the developed resource areas as well. For example, accessibility, connectivity, and affordability, ease of use also.
Absolutely.
From my standpoint, definitely workflow. Understanding evidence-based knowledge around how to deliver healthcare effectively is definitely, kind of slowing the pace of innovation. Also, I would say reimbursement. That is a big thing when it comes to doctors and some of these newer technologies that can deliver healthcare more effectively and efficiently to patients.
Absolutely. So outcomes, reimbursement, I know you've mentioned earlier security and privacy, workflow, a number of things that just don't exist in other industries and make healthcare very unique. So again, moving to why, and the why this should matter to employers and healthcare companies. What is the business case? And when you're talking to your various clients, how do you make a business case for digital health therapeutics?
So with one of our clients, for example, it's a large consumer health organization. And the business case for them was not only about selling more of their consumable health product, but also seeing if they could, through the digital platform, really impact the healthcare system. So when we look at a business case, we look at both the healthcare impact and also the business impact. And from the business impact, it could not only be the additional sale of the product or device, but it could also be, how does maybe an app enable you to create a new business model by actually white labeling it, or getting the data and being able to sell that data in an anonymized, de-identified way. Secondly, from the healthcare standpoint, we looked at, in this particular case, how could you reduce readmissions? How could you reduce infections coming out of a surgery? How could you actually reduce the time it takes to recover? Those are the kinds of healthcare impacts you can look at. And when you make all those types of cases, it makes it a lot easier for them to take it up to the executives that are going to make a no-go or no-go decision.
Yeah, and I would just say, from our standpoint, we actually work directly with the practices. So we need to understand, their reimbursement models, right, to kind of understand how are they getting paid. Luckily, value-based care is changing things a little bit for doctors, where they're looking at quality measures, and so that's helping with some of these innovations that we're trying to position currently. So right now we're working with a rural healthcare practice in Georgia, and we're focused on helping lower the BMI for their, these children. So we're looking at cases where there's reimbursement models, right, to help with that. There's some new things called patient-centered medical home that help provide reimbursements for that as well. So that helps pay for that, right? So now they're getting out of that fee-for-service world and more to quality-based measures. And then we're using innovations to kind of key in on those qualities that they're getting judged on and getting reimbursed on. So that's kind of how we focus in on our business development.
Thank you.
So for my audience, I think Theo's touched on a point here. They've never been seen as a revenue case. There's always been a needs case. They need the healthcare, they need the help, they need doctors, but there's not the affordability. But if the business model is developed correctly, there is a business case. So a good business case where the sector is not seen as a charity case, but a good revenue model. I think companies and small companies, startups will start making investments.
I know you had mentioned an example of a microscope.
Right. We have several different startup companies in our portfolio for our competition, the Wireless Innovation Project, which so happened to be open today. The contest opens today on our website. One of the companies, well, actually we have two mobile microscope solutions. And they initially started as a remote diagnosis tool, but they've rethought their strategy, and now they have a model for their tools here in the U.S., and it should be in the drugstore shelves as an ear infection tool, from mobile microscope to ear infection.
So whether your clients are major providers or vendors or physicians or NGOs and trying to get startups there and that we could then sell in the United States, having that business case and knowing where their revenue, it seems like the revenue and the outcomes were the two things that you all mentioned and highlighted the most, making sure that you have that concretely defined to be able to
Knowing
get
your needs
success.
and your clients, your customers.
Yes. Always.
Yeah, and there are a lot of people in the healthcare ecosystem, even as we were talking about before, there's employers as well, right? And they have a different type of business case in terms of employee productivity and retention. There's a company called Teladoc that provides telehealth services. They made a business case with an employer client, that showed that they actually reduced overall absenteeism and increased the overall productivity for their employees as a result of being able to access remote care versus having to take a sick day or putting off going to the doctor and then having their situation deteriorate to the point where they actually had to take more time off.
And that's something we discussed a lot at
Yeah.
ShareCare, that intersection of employee health and how that impacts the bottom line.
Yep.